going to tell you a bit about myself and also about the benefits of IDD therapy. My name is John Yeboah. I'm originally from Ghana, West Africa. I came over to England to study osteopathy, and that was between 88 and 92. So I qualified as an osteopath in 1992, so that makes it 30 years. So I've been in full practice for 30 years over here. Now,
where are you based?
I'm based in Bush Hill Park in Enfield, which is not very far from here. So, can I ask, are there any questions at all? Anything you would like to be answered by the end of the talk? Then let me know. Yes?
What does IDD stand for?
You read my mind. That's the next thing I'm going to talk about. So we will tackle that shortly. And is it Chris? Yeah, hello. Any questions at all? Anything you want answered?
I haven't started yet.
Okay.
Yeah. As we got on.
We'll save it up for you later.
Okay, yeah, we'll save it for last. Right, so IDD actually means intervertebral differential dynamics. Now, I think that's a bit too complicated. I think it should be intervertebral disc decompression, because that's what it does. So anyway, that's what we're meant to call it. And it's a non-surgical spinal decompression for back pain, neck pain, and sciatica. For those who don't know what sciatica is where you have back pain caused by a disc problem, a bone problem, a muscle problem, wear and tear, pressing on the sciatic nerve, which runs through from your back, through your buttock, down into your foot. That is sciatica. Now, I'm just going to play a short promotional video for my clinic, and then I'll move on to explain more. There'll be another video, explain more what IDD is, just to try and tell you or define what IDD is. After that, I'll tell you more about my own back pain journey, what led me to IDD therapy, which eventually has been changing lives. So let's have a listen to this one.
Do you suffer with persistent back pain, neck pain or sciatica? Are you stuck on a merry-go-round of painkillers and GP visits? If so, get help today with IDD therapy at Enfield Osteopathic Clinic. IDD therapy is the safe, non-invasive treatment for back and neck pain sufferers, particularly those who have a slipped disc or sciatica. IDD therapy uses safe and gentle pulling forces to draw apart specific spinal segments, removing pressure from trapped nerves and progressing relieving pain and improving mobility.
I've had 8 sessions and I really feel like I've been given a new lease of life. This feeling of stiffness in the back has gone. Immediately after the first session I had this feeling that my back was loose, that I could move. And yes, just feeling as if I've got a new back. It's an incredible feeling.
I've been training with free weights at the gym, which is something that when I went to see my surgeon with the initial problem that I was diagnosed with, told me I would never really be able to train with free weights again. So the fact that I'm actually able to go to the gym and use free weights quite so pain-free is fantastic for me.
If back pain is keeping you awake at night and upsetting your daily routine, book a consultation for free today. Call Enfield Osteopathic Clinic on 0208 482 1112 quoting IDD video, or visit www.enfieldOsteoclinic.com.
This is the second video, and that explains in a bit more detail what IDD is. Let's have a listen. Let's watch it.
Understanding your spine and disc pain. Navigating the complexities of your back or neck pain diagnosis can be challenging. There are a wide range of treatments that may or may not work for your condition. The first step in finding your best path to relief starts with understanding the underlying cause. Your spinal column is comprised of vertebral bones with a soft intervertebral disc for cushioning each vertebra. Paired facet joints in the back help support the spine while still allowing twisting and bending. There are 7 cervical vertebrae in your neck, 12 thoracic, and 5 lower lumbar vertebrae. Identified by their placement, common diagnosis for neck pain may involve C6 or C7. In the low back, L4-L5 is frequently problematic. Looking at each segment, the nerve roots exit the spine through holes in the back of the vertebra called foraminal openings. Herniated disc, degenerated disc, or facet joint problems can cause compression of the nerve root at these openings. This kind of compression can lead to pain or possible neurological symptoms along the nerve pathway through the limbs. These arm or leg symptoms are called radiculopathy or sciatica. Intervertebral discs are the shock absorbers of our spine. The durable outer portion of the disc is called the annulus fibrosus. It surrounds a jelly-like center called the nucleus propulsus. A herniated disc occurs when the outer disc walls break down, possibly due to compression or injury. As a result, the inner portion of the disc begins to leak out. When the leaking disc material pushes up against the nerves and other tissues in the region, it may become a herniated disc. Additional terms for this condition include bulging disc, slip disc, ruptured disc, or pinched nerve. A herniated disc will often irritate a nearby nerve and cause aching pain, weakness, and numbness that travels down the leg or arm. It may start as a sharp or burning shooting pain. Severe cases can cause you to stumble, have trouble lifting objects, or even struggle with bladder control. A healthy disc is typically soft, full of water, with a springy, almost rubbery quality. When you jump up and down, run, or walk, the stacked bones of your spine are spaced apart by the disc. Nerves to the arm and legs remain unimpeded, and the vertebral bones don't hit each other or break when we move. Disc cushioning is essential to every aspect of everyday life. Yet discs can wear out. Whether due to age-related wear, lifestyle factors, or genetic predisposition, the degenerated disc loses its plump, fluid-filled texture and begins to dehydrate, shrink, and flatten out, thus causing pain. Pain may be worse when sitting because the disc then bears a greater load and can no longer properly absorb the increased pressure or stress. If the disc base collapses enough to compress a nerve root, radiculopathy or sciatica may also result. As degeneration of the disc progresses, these changes in the disc can lead to arthritis, disc herniation, or spinal stenosis. The facets are small joints in the back of the spine surrounded by cartilage and synovial fluid to keep them lubricated. They provide load-bearing support to the spine and help with a wide range of movements like bending. Facet joint disorders typically occur alongside disc problems and can have overlapping symptoms. Degeneration of the intervertebral disc may result in concurrent degeneration of the lumbar facets as well.
It is official. A long one, but I think it answers quite a few questions.
What is stenosis?
Stenosis is where, well, in Greek, stenosis is constriction.
Right.
So anything that constricts a tunnel, a space, causes stenosis. So stenosis is constriction. So then when it comes to disc problems, you've got this intervertebral foramen. Now that can be constricted.
That's the disc, is it?
This is the disc.
Right, okay.
These are the vertebrae.
Yeah.
So basically, you've got all these vertebrae and they're separated by discs. So if you look at this intervertebral foramen, if I do that, that's a bulging disc. And you can see how it's constricting, narrowing the intervertebral foramen. And that can then pinch the nerve. And that's what results in sciatica, which is pain due to the sciatic nerve.
But excuse me, in stenosis, when you have severe stenosis, what
Yeah.
happens?
Yeah.
Then,
Yeah, good question. Now, we were going to come to that, but I'll touch on that. There are two main areas in the spine where stenosis is really, really relevant. So the spinal canal, which is this sort of V-shaped tunnel, and then this one, the foramen, intervertebral foramen. Now, when there's constriction, you get trapped nerve, especially if the constriction is here. The stenosis is spinal stenosis. It will contract pinch the nerves, and that can cause all sorts of problems. Now, the one that's really, really very important is where the chordae equina. The chordae equina is that part of the spine, or the spinal cord, below the second lumbar. It's called chordae equina because chorda is a tail and equina is a horse. So it looks like a horse's tail, and I will be showing you that. So when that happens, it can cause chordae equina symptoms. And chordae equina symptoms is where you lose the use of the front passage or the back passage, or you can't hold urine, and so on and so forth, which we'll come to that again later on. So stenosis can cause all those problems. Yeah, does it answer?
yeah. You don't stop a thing ahead with it.
Yeah, showing you loads of examples. Yes, the answer is yes. It is osteopathy, but it's more IDD therapy. Yeah.
What you're saying is focused, though, osteopathy.
Oh yeah.
It's focused.
IDD is a very, very specific focus, which is why we need an MRI scan before we actually get people on the table, and I will show you why in a minute. But yes, we need to know whether your problem is coming from the L5S1, which is this disc. We name the discs by the vertebrae above and below. So this is S1, meaning sacral vertebra 1, L5, lumbar 5, lumbar 4, lumbar 3, lumbar 2, lumbar 2, lumbar 1. So 5, 4, 3, 2, 1. So if you mean to mention this disc, you call it L1-2 disc. Some people make the mistake of saying L1. Is it the one above or below? No, you can't tell. So always mention 2. And if you read MRI reports, they never just say L1. If they mean L1, they mean the nerve root or the nerve rather than the disc. So you need to mention the two vertebrae. Yeah. Then were you asking a question? No.
Me?
Yeah. No. Not yet. Not yet. Okay. So we'll move on to what led me to IDD in the first place. Christmas 2014, I remember helping a friend move an old washing machine. You know, one of these old Hoover washing machines with a concrete at the bottom, you know, obviously to stop vibration. And although I lifted correctly, because I spent most of my professional life telling people how to lift correctly, you know, all that stuff. Use the knees, use the hips, not the back. I did all of that, and I had a belt on, and yet my back went. So Christmas, went through Christmas 2014, okay. Then January came, it got worse and worse and worse. Till May, I couldn't get out of bed. And I got my colleague to start treating, actually it was before April, I got my colleague to start treating me. And she treated me a few times. It was still relentless. I wasn't really resolving, you know. My back wasn't resolving. I started to get pain down my legs. And she kept saying to me, "John, you're limping." I go, "Yes, but I can't do anything about it." But May, when I couldn't get out of bed, I knew that was really important to look into it further. So I had an MRI scan, or she referred me for an MRI scan. And when I saw what was on the MRI scan results, I had about 5 things wrong. And I knew possibly surgery would be the answer. But I didn't want surgery at the time. So I decided to look for other alternatives to surgery. And then I remembered a friend of mine, Sally Lumsdale, mentioning IDD therapy to me several months back, perhaps even 2 years back. So I inquired and had the machine ordered from America. So in July, on the 1st of July, the machine was installed and I started IDD treatment. Now, I will be showing my own MRI scans and the results I've had. And later on, perhaps after the break, I will be showing you true examples from my own patients and the results we've had, including one that was last week. Really changing lives. So this is what a normal lumbar spine would look like on an MRI. So these are the vertebrae. Perhaps I can use that. Yeah, these are the vertebrae and the discs are between. Now this is a healthy lumbar spine because you see the discs look white, and that's because there's a lot more water in the discs. The discs need to be hydrated. So,
Excuse me, the discs, are they equidistant or they vary in distance?
oh, they can vary between person to person and within.
But in a one body, are they equidistant apart or they vary?
They vary. Yeah. So for example, the lumbar spine vertebra.
They do look different. So.
Yeah, there will be. In the lumbar spine, for example, they're bigger, they're more spaced. But if you look at the neck, they're really close together. They're smaller.
They're easier to wear around.
Yeah, look at the lumbar ones. Yeah. So they're not the same weight. So that's the normal lumbar spine MRI. The bit in the middle is the spinal canal. And remember earlier on I mentioned cauda equina, and I also mentioned this at the horse's tail. If you look at that, it looks like a horse's tail. Yeah, because there are lots of nerves coming down. If for any reason, usually disc problems or even fractures can pinch the nerve, and I'll show you an example. And that can cause all sorts of problems, including losing the use of your legs or the function of the front passage or the back passage. That is a surgical emergency. So if you have back pain and you go to A&E, one of the first things they ask you is, how's your waterworks, and all that stuff. Because if you can't control the front passage, the back passage, or you have numbness in that area, that is a surgical emergency. No one's going to hang around with that. Because if it's not decompressed within 48 hours, the patient might lose, more permanently might lose the use of those areas. So the next one is, so basically this is looking at the spine in this way. Yeah. Next one is a cross section. So we're looking at, the other one we were looking at it this way. Now we're looking at it this way. So this bit here is the vertebral body, which looks kidney shaped, that bit. And then this bit is the spine of the vertebra. And these are the transverse processes. I'm going into details because once you understand this bit, the other bits coming will be easy to understand.
Hello, my name is Georgie. I first came to this clinic on 6th of October 2018, 7 weeks ago. I could not walk because my right leg was weak and painful. I was using crutches and I could not sleep. It all started 4 years ago, but it was a slight lower back pain. But in September, 1 month before attending this clinic, I had severe lower back pain and a right leg pain, then followed by right leg weakness. I noticed a change right after the first session. My pain level before the IDD session started was 9 on a scale of 1 to 10. By the 5th session the pain had dropped to 4, and after my 15th session the pain dropped to 1. I don't have pain anymore. I have no weakness of the right leg anymore. I can walk normally now. I can now walk my 3-year-old daughter. I have gone back to work now. I'm able to sleep normally now. My main worry before I started the IDD treatment was the right leg weakness. I thought I would not walk properly again. It's not a problem anymore. So I would highly recommend John and Evelyn Osteopathic Clinic for IDD therapy for back pain and leg pain. Thank you, John.
Right, yes, he became a happy man. So this is basically his MRI scan, and that's his bulging disc. And as you can see, it's actually come out and gone downwards. Yeah, not yet fully sequestered. When a disc sequesters, it breaks, and it breaks and sort of
Fluid drains out.
there's a break between the bulge and the main disc, so there's a separation. When that happens, IDD therapy is going to struggle, so I'd always refer them for surgery. Yeah, because then you need to go in, do a microdiscectomy, laminectomy, where they actually go through the lamina. This is the lamina part of the vertebra. They take a piece out so they can get to, so if that's the bulge, they go through here, take a piece so they can get in there and scoop out the bulging disc. He didn't need it, obviously. And okay, so this shows you his report, showing his S1 nerve being trapped by the L5 S1 disc extrusion. So again, a happy gentleman there. Now I added this to it to show you. People ask me, what's the success rate for IDD? This is one study that was done. There were 415 patients, and 129 of them were labeled lumbar surgical candidates, meaning they needed surgery. But instead of having surgery, they sent them for IDD therapy, and that's the result. The success rate was 92%. Yes.
So can I just ask, can you be referred by a doctor to you then? Or so you can be referred?
Yeah, it will be private. It's not available on the NHS yet,
Right.
so you'll have to pay for it
No
privately.
osteopathy, is it?
Sorry?
No osteopathy is available yet.
There are a few osteopaths available on the NHS, yeah. Say it again, sorry.
You're the only one who does IDD therapy.
Yes, my clinic is the only clinic in this part of North London with the IDD machine.
What is your governing body that controls, corrupt ones or whatever?
The General Osteopathic Council does.
So people have got complaints or
Yeah,
they've been mistreated or whatever. There must be some referral somewhere, mustn't there?
Yeah, it'll be the General Osteopathic
So you have
Council.
to be registered with them to trade, do you?
Yeah, even as an osteopath.
Yes, I know that,
But IDD.
That comes under the same remit.
Yeah. And also, you have to have an indemnity insurance.
Yes,
For
that's right, because if you're registered, then you have to,
Yeah, so it'll be covered. So that's a good rate, I think. Now let's look at the next one. This is the lady who didn't sleep well for 3 months. So this is the MRI before she had IDD, and this is her now. Now, she saw me in September. When I saw that, I didn't want to take her on because it's the worst I've seen. Where this is proper stenosis. You can see the canal is almost closed, constricted to almost nothing. And she had pain down the legs, all the signs. The only good thing is she didn't have cauda equina symptoms. And that is why I took her on. Otherwise, I would have. She was waiting for surgery anyway. So I took her on in September. October she got better. November she didn't have any pain at all. And then December the surgeon called her, ready to operate on her. Gave her this MRI scan. The bulge is gone. And this, even the surgeon was happy he didn't need to do that. This is a cross section. So an axial, looking at it in this direction. This is her in December when the surgeon got the second MRI. And this was her before the IDD treatment. You can see the disc bulge almost pushing the chordae equina to the side, the nerves to the side. That should really cause chordae equina, but I guess there's room for the nerves to move about today, which saved her. Now, this is the surgeon's letter, and this is how it goes. I have seen this lady's repeat scan, and I'm glad to say the original very large sequestration has resolved and disappeared. So even the surgeon was happy, was glad he didn't have to operate. Right, now this is another example. That's one I keep. So, this gentleman saw me just before Christmas last year. If I check the date, that would be this was taken, this MRI was taken in August, 21st August 22, and that's his bulging disc. And you can see these discs, L4-5 and L3-4, are really good. They're well hydrated, they're bigger in height, and they're more spongy, so that one isn't happy. You can see it's darker. Water shows as white on MRIs, and these that are worn or dehydrated show as dark because there's less water, and that's the bulge. So I took him on. He got better, and this MRI was taken on the 24th of December last year, 2022. So that will be probably about just 4 weeks ago, and that's him. And his pain level went from 9, it's now about 1, 0 to 1.
After how many weeks? How many months?
So I would say 8 weeks. 2 months. Yeah. So now he comes back for top ups. Yeah.
How often?
He's doing 1 a month.
1.5 hour session.
It's a half hour, yeah. So with the IDD, you do heat for 15 minutes on the back, infrared heat. And then you're on the machine for half an hour. And then you have a cold pack for 10, 15 minutes.
Actually do, you have them several machines.
Yeah, we'll come to that shortly. Yeah. That machine looks like the one the lady's lying on. But I'll show you a picture and I'll explain that. If I don't by the end. Yeah,
I'll
remind me. And this is another one, a lady patient, and you can see there's a bulge at L4-5 and another one at L5S1, but L4-5 is the one that was giving her enough grief. And you can see the upper ones look light in color, so they're okay, but that isn't good, L4-5. This is her now, and you can see it's awfully gone, but you can see the spinal canal is clear. Yeah, so he had a bulge here.
Is that going right over to the right hand side? It's not
this one.
Yeah.
Well, that's the thing. This is bad stenosis because he's got wear and tear there as well. So that's
how old was he?
This gentleman, 63.
Yeah.
Yeah, 1963. So what is more serious about this is that this had actually come out and moved upwards. And that's difficult to treat. That man hasn't had surgery. All he had is IDD. That's it now.
What happened then if it was leaking out?
Yeah.
Did it actually
That's a good question.
disappear?
What's the symptoms he had?
Come down?
The usual lower back pain going down your leg. Yeah. And I was thinking, this guy must have caught equina. He had it at the beginning, but likely it was on and off. At the time I saw him, he didn't have it. So your question was, if it's gone that way, how come? Now, there are two processes when we use IDD. One is, which comes to one of your questions, when the patient comes in, we give them a pelvic harness and a chest harness, and then the table lowers, the table comes upright, they step on it, and they're lowered backwards. So they lie down. We attach one end, the chest harness to the top, and the pelvic harness to the machine. And machine has a bit that goes up and down, so it changes the angle. And the change in angle targets each specific disc. Now, so what happens is the machine pulls the back apart.
So you think
so the
it's going back to medieval, putting on
on a rack, simply. But this is a modernized, computerized version.
More
So the pelvic harness goes that way, and they're held that way, so the back is stretched. And when that happens, it creates a negative pressure in the area. It's a bit like having two wet plungers. If you pull them like that, if you pull them apart, what happens? It sucks in. And so if you consider the bulge, or this vertebra and that vertebra as two plungers, when you pull it, it sucks the disc back in. So it sucks it back in. So if the disc hasn't moved upwards, it's easy.
So
it moves it back in.
I didn't quite get. If you stretch it, you've got some suctions underneath that suck at the same time. Is that what you're saying?
It sucks the
So
bulge.
just stretch like that. So something underneath pulling the disc back to sort of create some sort of suction.
No. Yeah. So remember the analogy about the.
So you're on a platform like that, strapped in. So you go that way. Say you go upside down, right?
No, the upside down is to get them on it,
right?
And then you lower to horizontal.
Okay, horizontal.
So that's the position of.
Just run me through the simplistic base of how that works.
So two plunges. Like
where are the plunges?
So these are the rubbers.
Where are they on your body? Where are they appropriate?
Like that, up with it, like that.
Got you. Okay, right, gotcha, right. Okay. Sorry, I was thinking.
No, that's fine.
It's just an analogy, not real plunges. He's not putting plunges in.
No, actually,
I know. Next time,
I'm starting with all the plunges.
Next time I'm giving the talk, I actually have two plunges, so I'll demonstrate.
Yeah.
So if you pull them apart, let them stick. You pull them apart, they're going to suck in, rather like you doing. So that's what causes. It's been measured. I can show you the setup. They put a probe in the disc and stretched the person, and the probe measured the pressure in the disc, and they got, I think, down to about minus 160 millimeters of mercury. So that's enough to pull the disc back, but it doesn't do that at one go. The program itself will pull and let go halfway, pull and let go halfway, pull and let go halfway. And it's the repetition of it that helps draw it back in. Now, so that's that part. And then you'll ask me, what about that? If the disc is curved upwards or downwards, how do you put it back in? This is the answer. I think that has disappeared on here. Because if you look at that, that's lighter in color, it's a light grey color. Whenever I see people with bulges that are light colored, I'm happy because I know I can do something with it. There's more water in it. When the machine is operating at the top, which could be near half the body weight of the person, it oscillates at the top and comes back down again and then goes up and oscillates. And that serves as a pumping action. What it does is, it draws fluid, which would contain white blood cells and things like that to the area to engulf. It's called phagocytosis. Phagocytosis. So this gentleman, this MRI was done last week, 12th of January, a few days ago. What's today? 27th, so 2 weeks ago. 12th of January 2023. That's gone. he would have needed surgery to get him from here to there. I have to say though that I can't see why, even without surgery or IDD, some people can't reach there. Because the phagocytosis is a natural process anyway. If you have a boil in your mouth, it's going to heal. Why not the back? Isn't it part of your body?
Yeah, but not so much with the bones.
Yeah.
Tissue, yeah, but bones are a bit different.
They're a bit different. Ligaments don't have as much blood supply as blood vessels, as muscles, so they heal relatively slowly. So the disc doesn't have its own blood supply. The outer covering does. So that's why this thing, it takes months to heal rather than days. So that's why phagocytosis is why I think this gentleman improved a lot. So if the IDD can't pull it this way, the body's phagocytosis process is likely to help.
Can I ask you a question?
Yeah.
Even though you're pulling it in, it's going to come out again, isn't it?
It's a good question. Mine hasn't come out. I've got patients who had it 5 years ago and it
If
hasn't
there's
come.
no water, what's going to keep it from not coming out again then?
If it's dry, actually it's better
Right.
because it's not soft enough to bulge.
Right.
It's hardened.
See.
Yeah.
So
If you
what
go-
keeps it in then? What keeps it in once it's gone? in?
Scar tissue could be one, or the body's healing. I think it's mainly scar tissue. It will seal it. So that is what took him from there to there. The next thing is, that's the same person. But look at that. That patient it's very stenotic.
Yes.
But I only took on to treat him because that disc is grey. And I knew that the IDD can help the body to heal itself. And I think that's what the IDD does as well, to help the body to heal itself. This is him now, look at that. So he's happy, he's gone back to work.
And over what period of time was that?
This one would be before Christmas, that's August. I think I saw him in October. Yeah, October, November, December. So about 2 months, yeah. And so this is his MRI report. L45 remains grade 1, but this is the most important part. The previously noted focal left paracentral sequestered disc fragment, which was noted posterior to the vertebral body of L4, has now resolved. Yeah, so that was the radiologist's report. So he compared the two. Now, I knew that this would come up at some point. There are contraindications to an IDD, meaning they can't have IDD. One, if they're pregnant, obviously, or if heavily pregnant, you can't, and of course there's a baby as well. If someone is younger than 15 years of age, because the growth plates haven't sealed, you could separate the growth plates. If you're too heavy,
How do you work out with the too heavy?
we have a scale.
Because body mass index, there's a lot of controversy about that.
We use purely the mass, the body weight. We don't use the BMI or anything, just how much it weighs. That's because the amount of stretch we would give them depends on their body weight.
Yeah. So it's just purely their weight.
Yeah.
People are generally getting bigger and taller and heavier.
Yeah.
So presumably, do you have to mitigate that as you go forward?
Yeah. I mean, we don't usually get people who are like 425 or even 400 or 370.
That would be
very rare.
For the Americans, yes.
Yeah, well, yeah.
Yes.
I'm sure they can tweak the machine.
Plastic splints around their ankles to walk. It's the same thing.
Yeah.
I was wondering about the osteoporosis, severe osteoporosis.
Yeah. That's the other one. Actually, I had a gentleman come in. He came in a few weeks ago, but came in again yesterday, wanting me to go onto the IDD machine. But I'm convinced there must be osteoporosis somewhere because he's had rib fractures and spinal crush fractures. but he fell and injured himself. So he blames it on the fall. Well, the thing is, if he's osteoporotic, he can't have the IDD, but he wants the IDD. So, yeah. So I had to really, the more he pushed to have the IDD, the more I was determined to establish whether he's osteoporotic or not. And then he said, oh, he's already had an MRI, a DEXA scan, which is what I wanted. When I looked at it, it wasn't conclusive, the report. So I've referred him yesterday to have a fresh bone density DEXA scan, DEXA scan. And so hopefully I'll get that next week. And if he's clear, clear meaning?
Clear, it's not severe.
Yeah, meaning the T-score is less than, if it's below minus 2.5 or more severe, then he can't have it. If it's -1, osteopenia, he can.
Can I just ask, that referral, is that referred to an NHS scan? No. It's a private scan which you've got to pay for?
Yeah, he'll pay privately for.
So you couldn't ever refer that to an NHS MRI?
There'll be a waiting list, I think. I think these days
so the costs start mounting, that's what I'm getting at.
Yeah.
But then you can go back to your GP and say that I'm going to somebody's back.
Yeah, and wait 6 months for an MRI scan.
Yeah, obviously.
Yeah, I mean, this guy really wanted me to refer there that day, yesterday. Yeah. And so if its results turn out to be more than minus 2.5, I'm sorry.
No, it's less.
If it's less, if it's better than, rather than. Yeah. And basically the T-score, the Tesla score is, measures the strength of the bones basically, or how less depleted the bones are of calcium. Yeah, so the more negative the number, the worse it is.
Yes.
But you want a positive number. Yeah. And also his hip one was -1. But then we only rely on the one, the T-score on the area we're treating. So I wasn't treating the hip. That wasn't helpful. Yeah. Yeah, because you can have a different number for the lumbar spine.
John, can I just ask you something? You say you can't treat severe canal stenosis, but so what would happen? Would they have to have surgery for that?
Oh yeah.
Can you do surgery for severe canal stenosis?
Can I, or can it be done?
Yes, can it be done? Not can you?
Not can be done. Oh yeah.
It can.
Yeah. Yeah, severe stenosis. But this is how I look at it. Although it says here severe canal stenosis, you have to decide, as a clinician, is the stenosis caused by bone or a soft tissue? If it's a soft tissue, then you can pull back, continue and treat. But if it's a bone, then there's no way the IDD can pull the bone back. You need to surgically go in there and scoop, and literally chip off the bone to create more room.
And what is the success rate with an operation, do you know?
No, I don't. Yeah, I don't know the success
Still might be able to tell if you're
You've got to look at different surgeons, different hospitals, they all have different rates. But generally speaking, if the compression hasn't been more than a certain length of time, then you're going to have a good result.
Yeah.
Could I just ask a quick question? This
spondylolisthesis
and spondylitis, they're different.
Yeah.
What's the difference?
Yeah, spondylolysis is where, if you look carefully in this direction, it looks like a dog. If that's the nose of the dog, that's the ear, that's the front leg, that's the back leg. Can you see that?
No,
okay. So can you see? If that's the dog facing that way, that's the mouth, that's the ear.
Great imagination.
That's like a Scotty dog. Yeah, Scotty dog has more. So that's the front, the nose, the mouth. That's the eye would be somewhere here.
Yeah.
And that's the front leg, that's the back leg. This would be the neck.
The neck.
Can you see how? That would be the neck. Spondylolysis, there's a crack in the bone. So on an X-ray, from this angle, you see like a collar around the Scotty dog's neck. That's diagnostic.
Is that due to
Spondylolisthesis.
Is that due to osteoporosis?
It can be, yeah. It can be, or it can be through a fall, or it could be degenerative. Yeah, or possibly even genetic.
Yes.
Spondylolisthesis means that the vertebra has shifted forward. So if this bit is the bit that holds the vertebra from slipping forward, if that goes weak or gets broken, that will allow the vertebra to slip forward. Spondylolisthesis.
So it would not be, probably in that case, you will have to go further than the IDD. You got to do surgery on it.
Yeah, if it's a problem, then I would refer.
Yeah, refer, that's right. Yes.
Yeah, I would definitely refer. Now, if it's spondylolisthesis, if it's grade 1, we can still treat on IDD. I've treated a few. Grade 1 is where only 25%, a quarter of the disc has slipped forward. So if that's the whole width or breadth of the vertebra, if it's slipped a quarter forward, that's grade 1. If it's slipped halfway, that's grade 2. If it's slipped 75% forward, that's grade 3. If it's grade 2 or more, you can't have IDD. So grade 1 is fine, but not grade 2 halfway, too dangerous. And so on, it's pacemakers. And you can have it, severe canal stenosis, recent vertebral fractures, you can't have IDD. Very bad scoliosis, you can't have IDD.
Scoliosis, that curvature of the spine.
Yeah, when people go like that.
Can you treat mild scoliosis?
Yeah, I've done a few. The gentleman who had the sequestered disc, the last one, had mild scoliosis. Yeah, and he's improved. This one.
But he would have to have maintenance treatment, would he?
Because of the scoliosis?
Yes.
Not necessarily. Not necessarily, no. It all depends on how bad it is, whether it's degenerated spine, their age, their occupation, things like that, or will determine whether they need follow-up or top-ups. And if they've got cancer that's spread to the spine, you can't treat because for obvious reasons, and I've turned away a few. Yeah. Sequestered disc. Sequestered is when it's broken apart, but if it's still joined, I can treat it.
Yes.
Metastasis is where the cancer has spread to the spine, and so on. And peripheral neuropathy is the other one. Hemiplegia, paraplegia, where they're paralyzed, either on one side or both sides, is a contraindication. There are a few papers that has been published, and if you're interested in a list of references, references, one of them I mentioned earlier, where 129 lumbar disc candidates were sent for IDD instead. They improved, and the success rate was 92%. Yeah, that good. So all these, if you need it, contact me and I'll give you the references.
Apart from IDD, do you do osteoporosis?
I still do osteo. I'm still an osteopath, so I still do osteopathy. But in August 2021, my daughter qualified as an osteopath in July. So in August, she joined the practice.
Yes.
Now she does most of the osteopathy because I'm really very busy with the IDD. And it's partly because my clinic is the only clinic in this part of North London with IDD machine. So I would say 80, perhaps now, sometimes it's even 90% of my weekly cases are IDD. So become the IDD consultant. Yeah, and it's changing lives.
Can we ask roughly the price?
How
much the price?
Right, okay, so...
Per session or obviously per course, or how much?
Yeah.
What do you do, a package?
Roughly,
Yeah, we do a package as well. People need... Standard treatment is 20 sessions of IDD.
Wow. Yes.
Yeah, because most people would have had it for a long time.
Yeah.
Others would have a really bad bulging disc. So the recommended is 20 sessions. Some people get to 10 or 12 and they go, look, I can touch my toes. I've been sleeping right through the night. I don't think I need any more. But I tend to liken it to you have a chest or a cough and you go and see your doctor and your doctor listens to your chest and goes, oh, you have a chest infection. Can I take so you're diagnosed, and so he goes, take amoxicillin 3 times a day for 8 days. Would you say, 4 days, doctor, I don't have a cough anymore, shall I stop? He's going to say complete the course. So we encourage people to complete.
So cost?
Cost would be, it takes an hour to go through a session, and it's £90 per session. But if people book a block of...
So 1,800 quid is going to cost you to get your back treated.
That's right. You know that guy...
So how would you pay for that?
Yeah,
I know. If you pay each time, or do you pay all up front? You could do exchange bartering these days.
That's a good question.
Can you offer?
Because some people couldn't afford to pay, do you do a payment plan and things like that?
Yeah, it is possible. If you paid a block for a block of 10, we reduce the fee to £80.
Yeah, I knew you get
so,
And if you do 20, even more?
And it is possible. It's individual.
You're open to negotiation.
Yeah, exactly. I mean, you don't want to suddenly reduce it to somebody and find that they're driving out in a Porsche.
Yeah, exactly.
Do a financial inquiry.
One of the things I tell my colleagues and students who come to observe me working is never means test your patients. Just tell them what you believe professionally that will help them. And then they decide whether they can afford it or not. In fact, if you're means testing, then that's unprofessional. I think.
So let's just take if someone came to their own working tax credit or universal credit, then what do you do with them?
Nothing.
Usually, those people usually won't end up with you. They'll wait for the GP to
they cannot afford it anyway.
They'll get put off by...
so that's the logic you use, that's what I'm asking, that's the obvious logic.
I don't get many of them. In fact, for osteopathy I do.
Yes.
Coming back to the cost of it, so £80 a session, I charge £65 for normal osteopathy.
Yeah, exactly.
And the machine is £52,000. So it's something to pay for the machine, really.
And service and maintenance, is this maintenance together?
Yearly maintenance of between £300 and £500.
And how often?
Once a year at least.
On the top of that, obviously, do you have to pay for the CT scan? Or that
the patient pays for the CT scan.
You said that earlier, I did ask that question earlier.
That's okay.
You don't do it there.
How much do you charge for just the one consultation?
My consultations are always free. So coming in to ask me whether I can help you might take 15 minutes, half an hour, but that's completely free.
I mean, presumably you might have to have an MRI scan.
Yeah, so after the consultation, then I'll recommend the MRI scan. If I think they possibly have a disc problem that the IDD can treat, then I'll suggest the MRI.
If you've had an NHS MRI and you've got a report, which presumably the doctor, if you ask him, could provide it for you.
Yeah, that would be
sufficient. Work off that, could you?
Good you asked that question, because it has to be, the MRI has to be within the last 6 months. if it's older than 6 months, because your back can change. Even 1 month could be enough for the back to change. And yes, so we will ask for a fresh one, even if you brought one from your GP practice. But if it's within 6 months, that's perfect. I also prefer to see the images myself, because we're trained to read the images. I'm not saying I'm a radiologist.
So printed off image wouldn't be good enough, you want to see it on a computer.
It would be good, but better if I have, for example, let's say for example, the report says stenosis. I could just send them away. What if I saw the images and found that it's grey, because the report wouldn't say a grey disc. What if it was grey and it's soft tissue, which I should be able to treat? So by seeing the images, and also what we do is we compare the MRI results with the patient's symptoms and correlate the two. So MRIs, if we went outside now and grabbed the first 10 people we see without any back trouble, without any back complaints, and did MRI scans, if they're over the age of, let's say, 35 or 45, we'll find these things. And they don't necessarily have any pain. So seeing the results, seeing an MRI results mentioning L4-5, L5-S1 and all that stuff doesn't necessarily mean they're all giving the patient their symptoms. So you need to let them point to where it hurts and look at the pattern. There's something we call the dermatomes, and it's like a map of the various nerves where they give you pain or numbness. So if you say, oh, it goes into my little toe, we know it's L5-S1, and it's pinching the S1 nerve. If it goes into the big toe or the top of your foot, it's L5. If it goes into the knee and the inner side of your foot, it's L4. So then we look at the MRI. If it's L4-5, L5-S1 and L3-4, which one do you target? Because the machine targets one specific one, disc at a time. So to decide which one you tackle, you don't tackle all three. You ask them their symptoms, and if it falls within S1, you treat L5-S1. And that's, if you go by that, you get a really high success rate. So I've probably got 10 testimonials. 10 people saying, or 10 videos saying how much or how IDD has helped them. So I'm just going to play them, and you can stop me if you want to ask questions. And I think that will take us probably 20 minutes or so, and then be the end.
You got questions?
There's a section for questions if we do have time.
Hello, my name is Francoise. I've been having lower back problems for quite a few years now, and I've been seeing John for perhaps 2 or 3 years. And each time I saw him, it helped, but then the problem would reappear, triggered by different things. It could be gardening, it could just be bending over, or just sitting down, or just nothing. And I felt as if it was gradually getting worse, and didn't really know, what the future held. And then John told me about this new machine that he'd got, IDD machine, and I thought I would give it a go, why not? And I've had 8 sessions, and I really feel like I've been given a new lease of life. This feeling of stiffness in the back has gone. Immediately after the first session, I had this feeling that my back was loose, that I could move. And yes, just feeling as if I've got a new back. It's an incredible feeling. So we'll probably have a few more maintenance sessions, but I'm really very hopeful and very, very happy to have tried it, and I would recommend it to everyone. Thank you.
Okay, next one.
Hello,
Hello, my name is Maria. I was diagnosed with prolapse discs in my lower back 2 years ago, and I've had to endure extreme pain, spasms in my lower back, more so in the mornings where I found it extremely difficult to get out of bed. And when I finally did, my back was at a complete slant for hours, and it wasn't until I took painkillers that it began to subside. My husband was lucky enough to meet John, who discussed the IDD therapy with him in depth, and I decided that I would come along and have a session, which I did. I've had 7 sessions with John since then. After the very first session, in fact, the next morning I managed to get out of bed pain-free, which I thought, wow, this is a miracle already. And my pain on my first session was 10, from 0 to 10 it was 10. After my 7th session today, it has now come down to 0. And I cannot thank John enough for the IDD therapy. It was actually extremely comfortable and painless, and I can't thank him enough. Thank you, John. He's actually said that I don't need to come back unless I need some more boosters, which we'll see how I go. Thanks again.
Hello, I'm Jack. I've IDD therapy for the last 8 weeks. I met up with John in the middle of January 2019. I was in a pretty bad way. I was unable to stand up straight. Indeed, wasn't able to stand up for more than 10 or 15 minutes. I had real difficulty sitting down. After the initial consultation, I was graded as 7, so very restricted in my movement, quite a lot of pain, and really having met up with my GP and surgeon, was really anticipating having to go to surgery, at least having a steroid injection. Anyway, I commenced on the IDD, and after some 6 or 8 sessions had significant improvement. So moved from a pain threshold of 7 to a pain threshold of 1. Being able to commence work was after 8 sessions. And then on the 10th session, actually went to a threshold of 0. So was able to perform all my daily tasks, resume work to the full, and made me fully operational. Following advice from John, who's been professional throughout and given me a lot of confidence in the IDD therapy, I continued for the full program. That's 20 sessions, because my interest was not just to get well, which I was delighted to have improved so quickly, but to actually maintain that good health for as long as possible and hopefully permanently. So I would certainly recommend doing that. I now have absolutely no symptoms, so I'm feeling really very positive about the IDD therapy and the way it's been administered over here at the clinic. Hello.
Next one.
Hello, my name is Lynn. I came to John first on the 6th of June with terrible back pains. It was having a dreadful effect on my life. I couldn't sit down, I couldn't walk, and I just spent most of my time laying on the floor. The pain just got worse and worse, and I came to see John. He suggested that I had an MRI scan, which I did. That showed disc problems, bulging disc, a herniated disc, and John suggested the IDD treatment. I started the IDD treatment and it went well, but I didn't feel an immediate relief of pain. However, I kept going because it was explained to me very clearly by John what was actually happening in the body, how it was helping the body to heal. And I really appreciated that explanation constantly and the encouragement. But I continued the treatments, and by the 8th of August, that was 20 treatments by then, the difference in my back was unbelievable. And I really would recommend IDD treatment so strongly to anyone that has these back problems. But I would really like to say you must stay with it, complete the course, and know the good that it's doing in your back, although it may take time to accomplish that. So I highly recommend it, and highly recommend John in all his help. Hello?
And Regine.
Hello, I'm Gary. My lower back started with a slip disc in 2010, and the initial agony gradually resolved itself over a few months, but left me with ongoing problems that I had to be careful about. Taking too long a stride and walking, twisting and getting up out of a chair could end the painless previous few weeks and see suffering another chronic attack. Sometimes acute attack of pain that would leave me bedridden and immobile until again over time it would right itself, and this developed into a cycle over some years. It wasn't until 2017 that I found John and his IDD machine, an MRI which confirmed the bulging disc problems in my lumbar spine, and decided to go ahead with the IDD treatment. Booked up first 20, which is I think the recommended initial fairly intense program. And I read around the time a lot of people saying that they tend to find noticeable relief after the first 10 or maybe 15 sessions. I can honestly say that within 2 or 3 I was feeling the benefit, and after 9, 10 I was largely pain-free. Completed the course anyway, all 20. And the chronic episodes, the care that I had to take to nurse the weakness in my lower back, all gone. Pain-free for the last 2.5 years now. I continue to have the odd treatment as and when I feel I need it, not because I'm in pain, but every 3 months, maybe 4 months, just to give it another little stretch, just to keep the pain away, because I don't want to go back to those dark old days. For me, the IDD really has worked, and I couldn't recommend it more highly. Hello, I'm Gary.
Hello, my name is Eleanor. I came to John having had long-term back problems and really needed help. I had been having acupuncture privately, and which helped a very small amount, but really needed a lot of more help with the situation, and had an imminent holiday, so really wanted to be pain-free and comfortable as possible, being a trip of a lifetime actually. So came along to John and started with the IDD therapy that had been really highly recommended. Sure enough, after the first visit, the pain in the very top of my leg had gone on the first visit. Subsequent visits, each time the pain alleviated, and my pain scale decreased on each visit until I found myself being a different person, and really, really happy and relieved to find the condition getting a lot better. So I found the treatment very comfortable. John was very tentative, making sure I was okay, and listened to recordings that I could relax with, relaxation, sort of meditation audios, and found that the pain scale would continually decrease and now come from maintenance, which basically helps to keep the back issue under control. So I'd highly recommend coming for IDD with John. Thank you. Hello.
Hello, I'm Barry Palmer. I'm age 78, and I've had a degenerative disc problem for something like 3 or 4 years. In recent times it's been extremely painful all the way down the side of my leg, and it's really crippled some of my activities. First of all, when I came to have the IDD treatment, I only had a few sessions, and I didn't take it as seriously as I might have done. I later came back, and although at 15, 16 sessions I began to think, is this going to work for me? I stuck it out, and it really is important to keep with it. I really started to get relief. And 26, 27, and I am now completely pain-free and have been within, between the fortnight sessions that I'm now having. I'm about to go to 1 month session, and I expect to continue to be fully recovered. If you're prepared to stick with it, it's a wonderful form of treatment, and just thanks to John Yeboah for introducing me to it.
So he came back to report on how he's progressed after some time.
He looks younger anyway.
Yeah.
About 2 years ago, I was suffering considerable pain, particularly in the left leg, as a result of a degenerative disc. And I started the IDD treatment, and after some considerable number of sessions, I became pain-free and have remained pain-free for the last 18 months. All I have been doing over the last 18 months is to have periodic top-ups. I've just had a session today after 4 months, and I've remained pain-free, and really life has just changed remarkably.
That's good.
Yeah, that's a good one. You know, he's 80 over 80 now. So the older you are, the more difficult. And he had it 2 to 4 years before.
Oh wow.
Yeah, back in leg pain from degenerative spine, degenerative disc disease. Here we go.
Hi, my name is Jeanette. I came to see John last year at the end of November. I had quite bad lower back pain. They gave me an MRI scan, and it showed that I had bulging discs in my L4, L5. And I had a steroid injection, which worked really well for me for about 4 or 5 years. And then after that, gradually it started coming back much stronger. This time I had really bad sciatic pain all the way down my right side, all the way down my leg. And by July last year, I really couldn't do anything that was affecting my life in a big way. I couldn't go to the gym, couldn't walk anywhere, even going to work was really difficult, standing, sitting for any length of time. I came to see John because it was recommended to me by quite a few of my neighbours who had also had treatment by him. He recommended that I had the IDD treatment. I'd never heard of it, but I was confident, because he'd been recommended that it was the right thing to do. So I made the investment, and I had the first block of 10 treatments. It gradually started to get better. Every time I came, we looked down the scale to see where my pain level was, and it started to get lower and lower. I had another block of 10, and after that there was a real improvement, and I could start to do things again, start walking and things like that. I also had a little bit of massage and manipulation after each treatment. And I'm glad to say now that I feel almost back to normal. I can start going to the gym again, I can walk quite a distance, I can go to work, and I feel normal again, and I never imagined that I would. So I would really recommend the IDD treatment to anyone. It's definitely worth the investment. Hi, my name.
Hello, my name is Angela, and I'm going to tell you about my experience at John's clinic here in Bushel Park. I came with a bad back last year, and I was very sceptical about what he could do for me, because I'd run out of options, or at least I thought I'd run out of options. But somebody introduced me to John, and gradually, slowly, my back got better. Now that sounds so simple, but it isn't simple. When you're in pain, you're desperate and you'll do anything. And I didn't have much faith in it. A whole year later, IDD has changed my life. I am now able to participate in my sporting activities, my body pump, which I enjoy. I don't spend time holding my back, walking slowly, being miserable, being in pain, taking painkillers. In fact, nothing. I'm just happy now, and I come back for top-ups. I don't live in London anymore. I come back for top-ups, and I would thoroughly recommend coming to the IDD clinic here and getting treatment, because living with pain isn't compulsory.
Hello, my name is Nissim Abraham. I am 81 years old. I first came to see John about 3 months ago as I had severe back pain and hospital and doctors weren't working for me despite taking high-dose morphine. After I spoke to John, he recommended that I go on to IDD therapy. And I must say, from the first day, I felt an improvement. By about the 10th session, I seemed to be getting much better with very low back pain. And by about the 15th session, I was completely free of back pain. I carried on with John as I felt the IDD was doing me a lot of good, and I just wanted to carry on with maintenance work, which seems to be working just fine for me. I have no hesitation in recommending John to anyone who may require such treatment, and I have also recommended him to a couple of my friends who will in due course come and see him. Thank you.
Hopefully there are a couple more and then questions. Amelia?
I've been suffering with back problem for quite a few years, and I've had some regular treatment, some gentle manipulation and such like to sort of try and help me ease the pain over the years. But this particular time I sort of suffered quite a bad injury, and I was looking for something different, something maybe that was a little bit more effective than the treatment I've been having for the previous few years. So I went on the internet, and that's when I saw the IDD therapy. The overall experience was excellent. Really pleased with the outcome, and I have to say, from the first treatment I had, I definitely felt better walking out here. I am able to now, which is important to me, I'm quite a sporty person, so I'm actually going back to the gym again, and that involves weightlifting, which I was told by the guy that looked at my MRIs, was a surgeon for Yeboah at the time. I would never be able to lift weights again. So that's something I'm doing now that I couldn't imagine doing before the therapy. Also, I'm playing
it's 22 hours
again, which is quite a sudden movement on the back, and something that I was told that I probably wouldn't be able to do again, but I can. And in general, I'm just much happier and healthier with my back not causing me any trouble. I can now see sort of a much better future for myself. I had one with whether I'd be able to do all the things I wanted to do, and now I know that things are a lot more positive. I've got a lot of time left, I hope, and now it feels like my back's got a lot of time left as well. I have already recommended this clinic and yourself to people. In my job, I meet a lot of customers where I'm around the houses working for them, and it's amazing how many people suffer with a bad back. So I have already recommended them to yourself, and will continue to do so.
And, this is an update, and I think that's the final one.
Hi there, I've come back in today to really just give everyone who wants to have a listen to what is the end of my story so far with IDD treatment. I came to see John just over a year ago now, about 13 months ago I started with my first treatment, and I can't emphasise enough, when I was outside this particular building, I was lying in my van in excruciating pain and had to be carried in to see John, which was probably one of the worst pains I've ever experienced. And from that point to where I am now, I cannot tell you how much of an improvement the IDD has helped me. Firstly, I think the most important thing to say is the reason I know it's helped me more than anything else is because I've done several other treatments which were good for a short period of time, but I found that I was constantly, every 2 to 3 months, having to go back with the same pain and having the same treatment, really feeling that although I was getting some sort of relief from the pain, wasn't actually rectifying the problem at all. The thing I'll say with the IDD is that, I did have to commit to a program of treatments, which I think I had up to about 15 treatments to date. And I definitely will say that although I did feel an improvement from the very first one, the improvements got beat to give my scorings of where I felt on pain relief and how the pain's affected me. I was ticking 0 for everything, which kind of made me wonder, why was I coming in the first place? But I know that definitely keeping it up just once or twice, 3 times a year is the way forward, but simply just to keep it from ever coming back, because I haven't experienced the pain or any bad feeling in the past 6 months minimum. I'm now, as I was before, I had my bad back cycling, swimming, running, I'm in the gym and I have a physical job. My life is now as good as it was before I had the back problem, so I cannot recommend it highly enough. It is 100% effective for me, and I feel that if you're prepared to go the distance, you're definitely going to feel the benefit from it. I'm extremely pleased.
Brilliant.
Hi there.
I mentioned before the break about stem cell research and regenerative stem cells, which is coming exponentially faster. Has there been any correlation between your treatment and that? Because they're saying going forward they'll be able to regenerate discs, they'll be able to regenerate hip bones, they'll be able to all sorts of stuff. Have you got any information on that, on where we are on that?
No. That would be the answer.
Because what they're saying is they'll grow new discs in the future very soon and stuff like that.
Yeah.
Or they can repair discs and things like that with because now they're doing regeneration rather than what's the other one they were using? Cloning. They're all doing regeneration now.
Yeah, I'm aware of that going on, but not in relation to IDD therapy. Yeah, stem cell I'm talking about. What I do know though is when patients come in with really bad bulging discs, if they have something like an epidural and then continue with IDD, we get really good results. So I'm thinking...
For the ignorant, what does a epidural do?
Basically, if you have a bulging disc and you introduce the drug they use is actually a steroid and a painkiller mixed. It's the cocktail. Yeah. And what it does is it helps to shrink the bulging disc. So then it helps to take the pain away from the patient.
I think someone in those mentioned that she'd had it done, but it only lasts about 5 years. And then
well, it could be 6 months, it could be, really...
There's no guarantee of how long that will last.
Yeah, it could be 6 months, it could be 3 months. I've had people get relief for 3 months, but it can be redone, maybe twice, or maybe even 3 times. So I'm actually thinking perhaps stem cell treatment with IDD could actually...
That's why I was asking, so I can see a correlation there.
I can see that being possible, and I can see that being beneficial to patients.
I can see that being the future, that's what I'm saying.
Yeah, I agree. Yeah.
I mean, the bionic man is basically here now, isn't it?
That's the thing, yeah. I do have a spinal surgeon who actually has his patients, if they're not bad enough for surgery, he gets them to have the epidural, and then he sends them off to me for a course of IDD treatments over a 6-week period, and then they go back to him and he reassesses.
The reason why I'm asking is because Andy Murray is a classic example. I mean, his treatment on his metal hip, as they call it, it's not really a metal hip, but it involves stem cells. He's the first person to come back to top flight sport at the top level with that sort of situation. No one else has come back like that. So that's what I'm saying. And so the future is here. That's why I'm asking.
I think I think it's still experimental, but eventually.
Well, I mean, no, for instance, with eyes, Moorfields are leading the world on that.
Yeah.
They've now grown an eye and attached it to a blind man whose back optics are fine, and he can see. Not 20/20 vision, but he can see. So it's only going to get better. From his own stem cells.
I agree.
Yeah, could I ask about the vertebrae in the neck, the C vertebrae? How is the treatment on that? Well, let me not say how different it is, but you've not said a lot on that. You know.
Well, basically, whatever applies to
the other vertebrae,
the lumbar spine will apply to.
But it's more delicate than the other parts of the. Because I have suffer from.
The cervical.
Yes.
We get
cervical.
more.
Cervical.
We get more lumbar spine presentations than cervicals. But mind you, the structures here are bigger.
Yeah, that's right.
And this area takes your whole body weight. So that this area is more vulnerable. We don't lift things with our heads, but we lift things with our upper bodies. So we tend to put more strain on the lower back than in the neck. And that's why I think we get more people coming with lower back problems. But yes, we do get necks as well, but not as many as.
But is it more dangerous with the neck than the other vertebrae?
More dangerous. The neck is more vulnerable. And that is why with the lumbar spine, someone can have even 120 pound stretch, or even more. I think the highest I've done is 150 because they're heavier. But with the neck, the maximum anyone can have, even if you're 400 pound weight, is 30 pounds. No more. Any more than 30 pounds, the machine will stop completely. So because it's more vulnerable. And as you can see, the neck actually is a more complex structure compared to the lumbar spine. The lumbar spine has bigger structures and it's easier even to operate on here than here. Because these are really so close together. And so there's a higher risk if you're doing surgery on here than here, I think. It's more dangerous, but more vulnerable,
And in terms of patients, do you see little, of people who come in with the C1?
Yes. In my own practice, I think it's about 1 or 2 out of 10.
1 or 2?
2 out of 10, Mostly it's lumbar spine. Currently I'm treating 2 people, and the rest is all.
Is that because as you get older, people tend to turn their body to look instead of turning their neck? They don't realise they've got a neck problem. They've just adapted their body as they get older. They tend to turn like that.
Usually it's only when it starts to go down the arm and it gets numb and.
They've got a problem with their neck, but they don't realise
because they can get around it.
Because they turn their bodies, they don't realise they do it.
But when it starts to go down the arm and the fingers tingle and at night they wake up with a numb.
And toes as well.
That's the neck doing that.
Sorry?
That's the neck making tingle. If you lie and you wake up with that.
You're lying on the nerve.
Oh, right.
So you lie on the nerve if you haven't got the right pillow, for example. You lie on the nerve. If it tingles here, between these two, the thumb and the index finger, that is C6. So the 6th nerve, 1, 2, 3, 4, 5, 6.
That's the last one in the neck, isn't it?
No. And then you've got the 7, C7 is the one below. And then you've got C8, then T1. So that's down here.
What is the normal one that causes the problems then?
C5-6. So these two, the thumb, index finger, these two, most common. And so yeah, the most vulnerable part of the neck is C5-6, hence.
Not C4, not C3 and C4.
Yeah, you do get it, but not as common as C5-6.
And is that tingling that you get only when you're lying asleep? That's when you're lying dormant.
Yeah, but you can get it even during the day when you're not lying down. You can get it anytime. Some people,
if you lie down on the phone for a long while and that hand goes numb and tingly, is that your neck causing that? So you let's say you hold a phone to your ear, let's say 3/4 of an hour, and you realise your hand's gone dead. Is that part of the same neck?
It could be. It could be even the ulnar nerve.
Okay.
Yeah, there's you know, when you hit your funny bone and you get like an electric shock.
Yeah.
If you're
just hold it like that, you're not resting your knee.
If you're not resting it, it's less likely to be. But mind you, you're bending, and if it's vulnerable, you've got the tunnel here. Yeah. So if carpal tunnel is here, yeah, you can have you know, a compression there as well. But usually it's the neck.
Stems from the neck.
Yeah, because the nerves that supply your arm come out of the neck, a few of them, and they join together, and that runs down the arm to 3 main nerves: the radial nerve, the median nerve, and the ulnar nerve. So when you get it down the leg, it's more the lumbar nerves. So you get a few nerves coming out of the neck into the arm, and
that's
then you
the
get
sciatic. That's the sciatic.
when it goes down the leg below the knee, that's sciatica. So that's a sciatic nerve basically.
And that's the distribution.
If you do get problems down the leg, which is due to a problem in the neck, that's serious, because that means you're hitting the spinal cord, or whatever it is, a disc, a bone, or an osteophytic bar is hitting the spinal cord. That is serious. Yeah, basically a growth, bone growth. So you see how this nerve is exiting. If you've got a bone that's growing here, usually it grows from here. I mean, this is actually showing a little bit growth, like a lump. We usually call it osteophytic lipping, because it's a bit like it's grown extra 2 lips above and below the disc. That can also hit the nerve. Yeah, and if it does and it's really large, it will have to be surgery.
It has to be removed by surgery?
Yeah, it has to be trimmed, but it's such a complex thing. I guess doctors will try other approaches first before going for that.
Sorry, can I ask you, would it be the neck if you've got pins and needles in your hands? It wouldn't be anything to do with your lower back then?
No.
At all?
No, unless you're compensating, so you're like that, and you're compressing the neck. Usually it would be the neck. So the lower back wouldn't cause the neck pain, but the other way around, the neck
What
can
if you've
cause
got no neck pain, but you've got
tinglings?
Yeah.
It could be, there's a condition called thoracic outlet syndrome, but that would be related to the neck.
Right.
What is that?
When the nerves come out of your the neck, they reach the group, the plexus, the group, and then they pass between the scalene muscles. The scalene muscles are 3 muscles that connect from the neck to the first rib and the second rib, and the nerves pass between those. So you've got the rib underneath, and then the scalene muscles, so they form like a triangle. And when those muscles go into spasm, I see that a lot, and I treat it osteopathically. So when the muscles go tight, it narrows the triangle. That's the thoracic outlet. So it narrows it, and because the muscles are pulling the rib upwards, it lifts the first rib, the second rib, and that pushes into the nerve. So you get brachial neuritis, you get tinglings down the arm, not because of the neck per se, but the muscles here. So coming back to your scaling syndrome, scaling triangle problems can give you symptoms down the arm which has nothing to do with the disc.
Wow.
Yeah. Yeah, it's very common.
Really only a scan or an X-ray will analyse that, basically.
A scan may not necessarily even show that. You have to clinically test them. Absence maneuver is one of them.
That's the way you decipher whether it's...
Yeah. I think,
You're saying
Unless-
it wouldn't sharpen the scan?
The muscles being tight would not necessarily, unless they specifically look at the level of the first rib. If it's too high compared to the other side, it would suggest that the scalings are pulling it up. So then you can make an inference. But usually clinically, if you have the person lie down and you push down on the scaling muscles, they'll go, oh, I can feel the tingling in my arm. You don't even need a scan, yeah.
That's a very quick way.
It's a very easy, quick way, and I see that a
Where do you
lot.
press there?
Okay, so if you imagine a triangle, right, okay, so these are the scalings, and this finger is the first rib, and the nerves are coming out through here. If these two are tight, that's going to lift that up. So what you do is when you put your finger on here and push down, or down this way, you're actually stretching it.
Gotcha.
But it's also touching the nerves between here.
Gotcha.
And so they'll start to feel the tingling. So normally you should be able to press and they shouldn't feel the tingling. But if they're more vulnerable, in other words, the triangle is narrowed, then you easily reproduce the symptoms. And that's really usually very diagnostic. People with postures like that get very shortened scalings, and they can get thoracic outlet syndrome.
That's how you get a hunchback then, is it?
And that could be postural, I mean, you can get kyphosis, which is kyphosis. You can get kyphosis from posture. That's a common one. I think, a dentist I know because of work involves bends over. Maybe surgeons would do that. Carpenters, car mechanics, they're bent over all the time. So, but also you can get kyphosis from...
And everyday people who bend over the computer.
Yeah, that's right, computer. That's
That generation will have it, basically.
But there's a condition called ankylosing spondylitis. I can get people to stiffen up as well, and be kyphotic as well.
Because they do recommend you sitting there bending over, you stand up every hour and walk about, don't they?
You should do, it's a must.
You should not sit there for more than an hour.
No. So there are software programs they can install, or alarms, excuse me, that will remind you to get up and move around.
Well, I work in the radio, and a lot of times now in studios they have us standing up all the time when they do the program now, not sitting down.
Yeah.
A lot of the radio programs, the presenters are actually standing up.
Yeah, good thing.
Because it keeps you more alive as well.
Yeah.
Because they've been told by safety and welfare, it's very, if you're doing a 3-4 hour program, you basically sit there all the way through. It's not, they get you to stand up and walk around. Because these days with modern technology, you don't have to be plugged in like you're not. You can walk around.
Do you have a payment structure, in terms of cost of this treatment? A payment structure, say you pay that and then you continue in installment, or is it you have to pay the full amount according to how the treatment is given? Whatever that means.
Yeah, it costs £90 per session, which lasts an hour. Some people prefer to what I call pay as you go. So it will be £90 a session. But if you do a package of 10 sessions at a time, then you have to pay for the 10 at one go. So we reduce the fee to £80 a session. So you have to pay £800 right from...
You said 60.
Say it again.
Did you say 60 when you reduce?
60 is when you have osteopathy.
Okay.
But for IDD it's a bit more. Because the machine itself is £52,000.
Oh, yes.
And we've got to pay for it.
And service.
Yeah, and servicing.
Because at the end of everything, money comes in. We see it in everything we do. The cost is very important. And if the ability, the propensity to be able to pay is also very important. That's why I asked the question.
So it sounds like we haven't got any more questions. Having answered Penny's direct question about insurance. Thank you very much. Thank you very much, John.